Today's topic is endocrine disruption, otherwise known by the layperson as estrogen dominance. I have 30,000 patient customers over the past 20 years since 1999. We have a very high rate of success if and only if they follow detailed directions. My name is Renwanye MD. My pen name is Peter Eckhart MD on the web. And you can find me at clearwoman.com. First, I'd like to show you a PBS video.
Six years ago, marine biologists became alarmed at reports of massive fish kills on the rivers in this region. Every year, smallmouth bass were being decimated by some mysterious problem. Spring and fall, hundreds of fish would be found floating in the water, belly up.
So you see this.
I caught up with Vicki Blazer, a fish pathologist with the U.S. Geological Survey, who was trying to figure out why the fish were dying. What do we got here?
So here we have this large discolored area in the liver.
Yeah.
And then you see all these little white spots. Here's another totally discolored area.
And that's a signal of some bigger problem.
Yes, when we see a really high prevalence in a population, that indicates there's some problem going on in that water.
And when Blazer dug deeper, she found a surprise.
One of the major and most interesting findings was intersex in the male bass. When we look at the male gonads or testes, what we find is immature eggs within the male testes.
So you got sort of feminization of male fish. Is that a big alarming finding in marine biology, aquatic biology?
Yes, and that has certainly attracted a lot of concern and attention.
Scientific studies have linked abnormal mutations in marine creatures, like intersex, to exposure to chemical compounds that mimic or imitate natural hormones in the body. These chemicals are called endocrine disruptors.
Endocrine disruptors are very, very potent chemicals at infinitesimally small quantification. I mean, you're talking about parts per million or parts per billion. They interrupt the normal way in which the body controls everything from growth and development to thyroid function to reproductive function to estrogen levels, testosterone levels. So they're very, very important, and they are a deep concern because there's so many of them now.
There are thousands of these worrisome chemicals that have gotten into the environment, and one reason is that they're part of everything we do.
The list of things that bring these organic pollutants into our bodies is a long list, and it ranges from home care products, soaps, toothpaste, cleaning agents in the household, to things we put on our lawns, the things that we use all the time, the plastic industry, the rubber industry, lubricants, fuels, the highways.
When you see scientists like Vicki Blazer cutting open fish, finding intersex in the male fish, seeing high levels of fish kills, seeing immune systems disrupted, seeing other damage to the fish, is that a warning to you potentially about human health?
Oh, absolutely. The warning not just from the smallmouth bass in the Potomac, but from amphibians all across the country. You have frogs with 6 legs, hermaphroditic frogs, male frogs with ovaries, female frogs with male genitalia. These are the canaries, the modern canary in the mine, that we haven't been paying enough attention to.
Poisoned Waters. Watch online or on air beginning April 21st.
So Johnson & Johnson had a product liability issue. This is from their website. Johnson & Johnson's product was claimed by 22 women to cause their ovarian cancer in July 12th of 2018. Okay, and so Johnson & Johnson had to pay them $4.7 billion of the B to 22 women. Okay, and I wish I had their previous website, but they were saying that 90% of the ingredients in cosmetics and toiletries are toxic. Now they're saying do not meet our stringent requirements, and they're saying only 2% of the ingredients in cosmetics and toiletries are okay. So today I'm going to give you my treatment strategy for various diseases that include PCOS, PMS, PMDD, premenstrual dysphoric disorder, polycystic ovarian syndrome, ovarian cysts, endometriosis, adenomyosis, migraines that vary with the cycle, fibrocystic breast disease, uterine fibroids, cervical dysplasia, acne that varies with the cycle, menorrhagia, dysmenorrhea, some restless leg syndrome, benign prostatic hypertrophy, some Raynaud syndrome, precocious puberty, gynecomastia, and menopause symptoms. Really, we're going to do that today. And the only problem with this treatment strategy is many women don't want to do it because it's difficult to change their lifestyle in a detailed manner. And what do all these diseases have in common? Well, they're all endocrine disruption diseases. So simply, if you just stop poisoning yourself, then all these diseases will simply disappear in 2 to 3 months. This is the washout time. You can take some topical transdermal natural progesterone as a band-aid and some supplements, but really you're just poisoning yourself. It's very simple. Just stop poisoning yourself. So the plan today, I'm going to talk about endocrine disruption and xenoestrogens. So I'm going to talk about natural progesterone, what is it? And I'm going to talk about some case studies. Okay, so here's again one of my patients, and she's going to promote my product, natural progesterone, but try to listen in between the lines. Basically, she just stopped poisoning herself. So this is my real PCOS patient. She was brave enough to put her face on the web. She has 11 years of PCOS, which is gone in 90 days. No drugs, no progesterone. With PCOS, she ovulated twice a year, but now has a normal every month cycle. So here she is.
Hello, my name is Hannah, and I've had PCOS symptoms since I was 11 years old. When I was 21, I was finally diagnosed with PCOS after years of irregular bleeds where I would bleed for months at a time, lots of acne issues, male pattern hair growth, and some pretty bad anxiety. I was newly married at that time, so I decided to try to do something about my PCOS naturally, and I got into all kinds of forums and boards that I could find in groups on Facebook, and I tried all kinds of herbs and minerals and vitamins and different ways of eating, and I ate paleo, and I tried everything I could think of to correct my hormones on my own. Nothing worked, and a year and a half later, I just had a huge box of pills that were just kind of in their own graveyard because I knew that they didn't work, and I didn't know what to do at that point. And that's when I found Progestin, and I read the booklet for the first time, and I just remember thinking, oh my gosh, this is what I've been missing all this time. I've been trying to put these pieces together, but nothing connected until now. And it made so much sense to me all of a sudden. I have estrogen dominance. Is that really just something I have, or is it something that's being created in my body by things? And so having that answer was really, really important. I talked to Dr. Eckhart on the phone for about an hour the first time I talked to him, and he was so helpful and really lit a fire in me to get this started and to start healing for the first time. He talked about how long it would take using Progestin to begin ovulating so I could hopefully conceive. And he told me about 3 months, and it was 80 days later that I ovulated for the first time in 9 months. And then the next month I ovulated again, right on schedule, and I conceived that month for the first time. During my first trimester, I had some bleeding, and it scared me a little bit, but I knew what to do because we had discussed it before. And I called Dr. Eckhart again, and he gave me information on how to stop the bleeding using Progestin. And within a few days, the bleeding was gone, and I went on to carry a very healthy baby who is now 1.5 years old. Progestin has been an on-again, off-again thing for me, but whenever I get on it, I'm just amazed the difference in my whole life. My anxiety is the main thing, just when it's gone, and just when you can wake up happy and not be as fatigued and not be craving sugar and chocolate all the time. It's just such a different outlook on life. My skin clears up really, really well whenever I am completely on the Progestin protocol. Right now I'm enjoying pretty much the best skin of my life. The constant bruising that I've had my whole life always goes away when I'm on the Progestin protocol. My bleeding that's plagued me for all those years is not an issue anymore. My baby reminds me every day of how important it is to reset your hormones and to get your body at a good place. I was able to conceive totally naturally, not have any kind of injections or hormones besides the first trimester. And that experience is just the most amazing thing that has ever happened to me. If you feel like you've tried everything natural, I would really encourage you to give this a try. Even if you tried progesterone cream before, this is totally different. Like the protocol and the help you get from Dr. Eckhart. The Progestin protocol is all about healing yourself. And there's something just so empowering about that. So go to clearwoman.com, read the reviews, the testimonials on there. My testimonial will be on there under the PCOS. Thanks for listening and happy healing.
So just a brave patient, and she was willing to follow instructions and willing to go through the lifestyle changes, but not every patient is willing to do so. So let's go talk about endocrine disruption. I'm going to start with a story. I'm going to ask you some questions. This will solidify your thinking about endocrine disruption. Okay. So there's Clifford Block, MD, a pediatric endocrinologist, and in January 31st, 2007, in Colorado, Denver, Colorado, he had 3 young boys with gynecomastia. Okay. And he measured their own endogenous hormones, their testosterone, estradiol, testosterone, estrone, and found them to be normal. So the question is, why do they have man boobs? The parents were giving them topical Estradiol and lavender oil. And so on a hunch, he told the parents to stop. And in 3 to 9 months, the gynecomastia disappeared. All right, so gynecomastia is man boobs. Man boobs disappear in 3 to 9 months. The lavender and Estradiol separately showed to stimulate estrogen receptors in test tube breast cancer cells sensitive to estrogen. Furthermore, he had another line of breast cancer cells sensitive to testosterone, and shown the Estradiol and lavender was shown to block the expression of testosterone. So these boys are getting a 1-2 punch, estrogen stimulation and testosterone expression being blocked. And so the National Institute of Health wrote an advisory letter. And if you go to my website at clearroom.com under phytoestrogens, you can follow that link or Google it. So here are the questions. Question number 1. Can natural, organic lavender and Estradiol mimic estrogen? Well, the answer is yes, right? And does lavender and Estradiol appear on the hormone test? Well, the answer is no. So do you think that there are other herbs and chemicals that mimic estrogen that do not appear on the hormone test? The answer is yes. There's about 400 herbs that I know of and maybe 3,000 chemicals that I know of that mimic estrogen that do not appear on the hormone test. So many times patients or customers will come to me and say, hey, look, here are my 7 hormone levels. And how come I feel lousy even though those hormone levels are normal? And I'm just telling them, well, you know, to actually evaluate you, I would need 3,393 other tests. But you only have 7. And if I went to the lab and said, give me a hormone test about lavender or Estradiol, what are the lavender Estradiol levels in this patient? The lab would look at me like I'm crazy. Okay? So that's why I kind of don't do hormone testing, because I only have 7 hormones, or actually I need 3,393 hormone levels. Okay? So again, the lavender Estradiol did not appear on the hormone test. Do you think that there are other chemicals and herbs that mimic estrogen? And that's what we just went over. Okay? So in 2018, the NIH tested 8 different chemicals out of the hundreds found in lavender Estradiol. And 4 of the oils appear in both herbs: eucalyptol, terpenol, dipentene, alpha-terpenol. 4 other oils appeared in either oils. Okay? All 8 chemicals show different estrogenic or anti-androgenic properties, some showing high or little to no activity. Ramsey, PhD, states that many of these chemicals are found in 65 different essential oils. So there's several hundred herbs, several thousand chemicals that are hormone active. I've been criticized for not doing hormone testing, but that's the reason why I don't do it, typically. So lavender and Estradiol do not appear on the hormone test, right? Are there any foods or herbs or chemicals that you can tell me that increase estradiol? Anybody? Okay, well, the answer is coffee, chocolate, and cocoa butter. Okay, and what's this? Black African soap. So I had one naturopath in Spain, and she goes, I got estrogen dominance. I go, yeah, I can see that. She goes, here's my hormone test. Look, my estradiol is high. It's 300. I said, you're right. It is 300 picograms per gram. Okay. And I go, you're right. Your estradiol is high. She goes, I need progesterone to balance out my high estradiol. I said, no, you need to find out why you have high estradiol. And so I started talking to her, and she goes, I use all natural things. I'm completely clean. I said, no, something is causing your high estradiol. So it turns out that she was taking black African soap. And black African soap has cocoa butter. So the cocoa butter goes through the skin and increases your estradiol. Okay. So again, there's a 70% increase in estradiol with several cups of coffee, according to a Brigham Young University study. Okay. So question number 5. If you have breast cancer sensitive to estrogen, will lavender and tea tree oil make it grow? Yes. It'll make it grow. That's right. So if you take lavender or tea tree oil chronically, okay, it may make breast cancer grow. I'm not against lavender or tea tree oil, okay? So if you need to take it for about 2 weeks or a month, that's fine. But if you take it every day for the next 15 years, it may be increasing your rate of breast cancer, or risk of breast cancer, rather. So the other diseases like endometriosis, fibroids, ovarian cysts that flare with estrogen. Does lavender and tea tree oil make them worse? You bet. You know, I have patients that have endometriosis and they're doing okay, and then they flare again, and they call me up and goes, how come I'm flaring? How come it's getting worse? I said, what did you change? And she goes, oh yeah, I'm using lavender soap in my bathtub. I just changed to that. Are the producers of lavender oil and tea tree oil upset about this? Yes, they are very upset about this. They cite other issues, right, that say, hey, you know, this is a wrong test. They're using plastic test tubes. You know, this is not this and that. It's not that. They're very upset about this, okay? And they wrote bad things about me on the web, okay? And that's what you'll hear, okay, about bad things about me, because these people are upset, okay? Because I'm telling them what the research shows, okay? Number 9, can the chronic use of tea tree oils and lavender oils turn little boys into little girls? Well, unfortunately, this might somewhat be true. Okay? So they had 28-week gestation women who were screened for high levels of DHEP and DPP. These are plasticizers. They're found in IV bags. It makes the IV bags floppy. Okay? So they took women who were pregnant, 28 weeks, and they screened them for high levels. Okay? And then they looked at their little boys several years later, and the psychologists were saying they had feminized play. You know, they like to play house, like play tea sets. And I'm reading about this. I'm like, oh, I don't know if I believe the psychologist or not, or I don't know if I believe this study or not. But a black lady from Atlanta, Georgia, called me up, and she was giving her little boy lavender oil in his hands every night to make him fall asleep. And his little boy wanted to grow his hair long and only play with girls. So she says, I don't want my little boy to turn into a little girl. So she read my material, and she stopped the lavender oil. And the little boy now wants to cut his hair, throw rocks, and play bow and arrows. So I was flabbergasted when I heard this. I was like, what? Okay. So think about it this way. Imagine you're building a house. And the blueprint is actually the blueprint for the house. And the blueprint is analogous to the DNA for this boy. Okay. And then you read the blueprint or the DNA, and then you tell a messenger to tell the workers what to build. So you read the blueprint, it says build it. Okay, I'm not trying to be offensive at all, but that's just what it's saying. And the worker goes to tell the workers, hey, build it. And now all of a sudden you add lavender or tea tree oil, and it says, hey, you substitute in fake messengers for the real messengers, and all these fake messengers, they don't read the DNA. They just tell the workers in the house to build breasts. All right. So that black lady insisted that she was not leading her little boy, and this was really happening. I was just flabbergasted. So question number 10. He was born that way. The next logical question should be why is he born that way, right? Why is he born that way, right? Okay, now the question is, who wants you to stop asking that question? Okay, so now we're going to talk about the politics of endocrine disruption. About 20 years ago, the Endometriosis Association lobbied Congress to come up with a test for estrogen mimicry. So they knew that these chemicals were causing endometriosis. So they went to Congress and said, hey, why don't you guys figure this out? So Congress goes to the EPA and goes, hey, figure this out. And the EPA goes, well, we don't know how to do this. These things are active at fractional parts per billion, extremely small. We don't know how to test for endocrine disruption, okay? But after 15 to 20 years, the EPA comes up with a test. And if you Google EPA, they have Endocrine Disruption Screening Program, Endocrine Disruptor Screening Program. And basically, there are 80,000 chemicals in commercial use in the United States, and we don't know diddly squat about endocrine disruption, about these chemicals. So now the EPA wants to start testing these chemicals. But the industry lobbyists who make these chemicals don't want you to test these chemicals. Why? Because suppose you sell a couple $100 million worth of this one chemical, and the EPA finds out that it causes breast cancer. Well, guess what? You'll get sued. Right? The company gets sued and goes out of business. So they lobbied the EPA and lobbied Congress. We don't want you to test these chemicals. So I think they can only test a couple of these chemicals every year out of the 80,000. So basically, in cosmetics alone, the European Union has banned or restricted 1,300 chemicals. In the United States, only 11. So you can see the problem that we're dealing with as physicians. So let's talk about a few xenoestrogens. Alkyl phenols. Okay, they're used for making fragrances, thermoplastic elastomers, antioxidants, oil-filled chemicals, and fire retardant minerals, tires, adhesives, coatings, carbonless copy paper, and high-performance rubber products. Okay, bisphenol A. Okay, such as plastic bottles, including water bottles, sports equipments, CDs, and DVDs. Okay, it makes the plastic last longer. Parabens, right? They act as preservatives. Topically, okay, is much greater than oral. So they're widely used in preservatives and cosmetics and pharmaceutical products, okay? They're bioaccumulative, they build up in the fat, and they're found in breast cancer tumors. Industry says it's safe. So when I first started doing this, I go up to the compounding pharmacist, I go, what are you using as a preservative? Because there's water in this lotion. And he goes, we're using parabens. And he goes, look, if you feed it orally to rats, they don't get cancer, and it's non-toxic, and it's fine, okay? But what I told him is topically it increases rat uterine cancer. Topically increases rat uteri weight by 30%. Topically, okay? And you're using it topically. You're not taking it orally. So again, when you take it orally, the liver works on it and 90% metabolizes it first and then passes it on to the body, okay? But you take it topically, it goes right into the body, all right? So when you hear this quote that parabens are non-toxic, non-carcinogenic, do not cause a problem, that's orally. But the problem is you're taking it topically. So topically is different. Remember that. Topically is different than oral. Okay, anytime you go topical, it goes into the body directly and avoids being processed by the liver. Okay? Again, are you noticing a pattern here? They're ring-shaped compounds. They're aromatics. Okay? So basically anything with a ring, this benzene ring, okay, even phenol fits into the estrogen receptor. So we got a problem. Even fragrances, they're aromatics, right? They usually have a benzene ring, so all fragrances are usually endocrine disruptive and fit into the estrogen receptor. So if you look at a sick patient, where is the main route of entry of this garbage that's causing a problem? Well, I guessed it was the skin. So the skin dose is 10 times more in potency than the oral dose because it bypasses the liver, right? So the oral dose for a estradiol pill is 0.5 milligrams a day, and it's 90% first pass inactivated by the liver. Okay, but the topical dose, if you take a patch in a 24-hour period, releases 0.1 to 0.025 milligrams a day. So you can see that an estrogen patch is 10 to 20% more effective at delivering estradiol topically than orally. So that means that, oh no, your laundry, soap, shampoo, lotions, cosmetics, all these things are going into the body, some of which are extremely hormone disruptive, and that's why our patients are getting sick. So what do xenoestrogens do clinically? Let's talk about that. Okay, so we're in Austin, Texas. What does anybody know what the difference is between a steer and a bull? Well, a steer is castrated, right? And then they inject the estrogen pellet subcutaneously behind the ear. That estrogen pellet lets off estrogen, or sterol, okay, steroid, I'm sorry, not a sterol, but a steroid, okay, continuously over a period of months. And then what do you see? You see weight gain because you give this steer hypothyroid. And the steer has hypothyroid. It begins to decrease the sensitivity of the thyroid hormone. So the thyroid hormone level in the steer might be normal or low normal, okay, but it becomes less sensitive to thyroid hormone, becomes hypothyroid. And you begin to notice that this steer grows faster, which is what the rancher wants, okay? And then you have fat marbling, and then you have water retention, right? And if you have water retention, you have heavier meat to get more money, right? And it's more tender. Wow, we win all the way around, right? But American beef is banned in Europe because the Europeans believe that there's an increased risk of breast cancer. Americans measure the urine, and say, hey, it's clean. However, the xenoestrogens are stored in the fat. So if you wanted to assess the estrogen state of this cow or cattle, what you need to do is take all the fat in the cattle and try to measure the estrogen level. And so if you just took a small sample of the fat from somewhere on the cow, you may not get it because there might be some estrogen in one part of the cow but not in the other part of the cow. So it can be localized. Okay, so you might do a fat sample in one part of the cow and say, hey, it's clean, and do a fat sample in another part of the cow. Hey, look, it's got a whole bunch of estrogen in it. All right? All right. So basically you're giving the steer PMS. And yeah, I explained this to one woman. She goes, I know just how these steers feel. They go, I know this steer is feeling PMSy. Okay, so what does xenoestrogens do to people? Well, you get a magnesium deficiency, okay? You get muscle cramps. You get constipation, right? You get menstrual cramps because all the muscles constrict, okay? You get calcifications because, again, calcium and magnesium are kind of inversely proportional to each other. So what happens is when you give them xenoestrogens, they develop a magnesium deficiency, and then you develop calcifications, microcalcifications in the breast, calcifications of tendons and bone spurs, all right? And these tend to be calcium oxalate. You get chocolate cravings before your period, okay, because chocolate's high in magnesium, but chocolate's a xenoestrogen. So if you suspect a woman has PMS, right, or PMDD, premenstrual dysphoric disorder, all you do is ask them, right before your period, you get a chocolate craving? And they go, I got a chocolate craving. And the reason why is chocolate's high in magnesium. They get a pica, right? So they crave chocolate because chocolate's high in magnesium. But chocolate's also a xenoestrogen itself, so it makes the magnesium deficiency worse. All right? Arteries can constrict sometimes with vasospasm, right? And you can get Raynaud's, or you can also maybe get a possible heart attack, okay? Because, again, that muscular sheath on the outside of the artery will constrict or contract more and go have a cramp, right? And then all of a sudden you have restricted blood flow to the hands, to the feet, and possibly to the heart, all right? It may lead to migraines, right? The arteries in the brain can constrict and get constriction of blood vessels and get a migraine, okay? So how do I treat a xenoestrogen magnesium deficiency? Well, the treatment for the magnesium deficiency is simply to stop all xenoestrogens. After the xenoestrogens wash out of the body in 3 months, the magnesium deficiency goes away. And then you can give magnesium citrate until you almost get diarrhea and then back off. Magnesium oxide is poorly absorbed. Do not use magnesium oxide, okay? I think the absorption might be like in the single digits, maybe like 4%, okay? So most calcifications are calcium oxalate. So calcium citrate is 567 times more soluble than calcium oxalate. So if you give magnesium citrate, the citrate ion will complex with the calcium oxalate, and then the calcifications will simply disappear. So the calcifications in tendons, bone spurs, microcalcifications can revert to normal in about 6 to 9 months. So I did have one lady who had a highly calcified hand because she's so magnesium deficient, all right? And she could barely close her hand. She was about to undergo a $90,000 operation, and the surgeon would just manually take out the calcifications. I said, hey, just take some magnesium citrate, okay, without the stevia. Make sure there's no stevia in it because the stevia is hormone disruptive, okay? And within a couple days, she could move her hand again, and calcifications were getting better, okay? Migraines can improve or completely be gone, all right? Muscle cramps can be gone. the chocolate craving should be gone. Okay, so if you're not supplementing magnesium and still have a chocolate craving, you still have a xenoestrogen. So you still have a xenoestrogen. You're making like a magnesium deficiency. If you still got a chocolate craving, that patient still has a magnesium deficiency, and she still has a xenoestrogen that's causing the magnesium deficiency. All right. So you can check for compliance. You go, hey, are you doing everything you're supposed to be doing? And the patient goes, yes. And you go, do you have a chocolate craving just before your period? And she goes, yes. I said, well, then you still have a xenoestrogen in your environment. Okay. What do xenoestrogens do to people? One, you get a vitamin B deficiency. Okay. And you get a neuropathy with that, a fire burning, creepy crawling feeling, sensation, restless leg syndrome. Typically, some of the times these people can have a malabsorption. So you ask them, well, is there any problem with the gut? And they'll say no. Okay, but then you ask them further, well, are you on a special diet? Oh, yeah. I used to have a bloating stomach every time I ate certain foods, and I stopped eating those foods like wheat or gluten. And now, all of a sudden, I don't have malabsorption. I have a normal gut. Well, the very fact that they're having that problem means that they have a malabsorption in the gut, that they're on a special diet that's self-imposed, okay? And they may have a vitamin B deficiency, as in boy, okay? Typically, these people can either be, the malabsorption can be due to fear, stress, and anxiety. They may have gone through a psychological traumatic event like their fiancé dying just before they're about to get married in a traumatic car accident. That would be traumatic. Or they could have a parasite. So if they have trouble gaining weight their entire life despite eating, right? And they have a lack of appetite, you might want to guess a parasite, especially if the patient is young and their chance of cancer is not very big, right? You might want to think parasite, and this causes a malabsorption in the gut. They have xenoestrogens, all of a sudden they got a vitamin B deficiency as well, and they have this neuropathy, right? So this is like restless leg syndrome, all right? This neuropathy. So I did have one nurse who had an ascending bilateral paresthesia of both feet and legs. That was ascending, and she goes, "What's the problem here?" I go, "I don't know. You got and basically, are you eliminating all the xenoestrogens?" She says, "Yes, right." And she went to go see a internal medicine. The guy goes, "I don't know." You went to go see a neurologist? I don't know. She's a nurse, right? And she calls me up and she goes, "What's going on?" I said, "You taking vitamin B?" She says, "Yes," right? Okay, so I go, "I don't know." So we start talking about it for an hour, right? And then she calls back up later, a week later, or 2 weeks later, rather. And she goes, "Oh, I just doubled up my vitamin B in the morning, and the ascending bilateral neuropathy started going away." And I said, "Do you have any gut issues?" And she goes, "Oh, yeah. I got major gut issues. I'm on a special diet for, because when I don't eat the special diet, my stomach gets all bloated." Well, this lady's got malabsorption, okay? All right, so the treatment, you just give them remove xenoestrogens, and in 3 months the patient may become normal unless there's an intestinal malabsorption, all right? So you can take a vitamin B100 in the morning to prevent, and make it sure you take it in the morning, because if you take it at night, it may keep them awake at night. They may get vivid dreams from the vitamin B, all right? So watch out that the vitamin B6 is not over 200 milligrams, otherwise you can get a permanent neuropathy. So what do xenoestrogens do to people? Well, basically, you become hypothyroid. You have gained weight. So the patient might be dieting and swear to you that, "Yeah, I'm dieting. I'm reducing my caloric intake." But she's actually gaining weight. And you're thinking, "Man, this patient is actually telling me a lie," right? But actually, she is limiting her calories. And the reason why she's gaining weight is because she's using some kind of xenoestrogen that tells her body to build up weight. And so what happens is that you look at her and she has hair loss, she has thinning eyebrows, and she's gaining weight, right? And then basically xenoestrogens reduce the sensitivity to thyroid hormone. So you do a blood test, and a thyroid test shows that it's normal to low normal, okay? And you go, "This doesn't look too bad." But what's happening is the patient is actually becoming less sensitive to thyroid hormone. So it's not the thyroid test per se, but it is actually her sensitivity to thyroid that's happening, okay? So how do you treat them? You stop all xenoestrogens, okay? And then you give them iodine. Now, most Americans are deficient in iodine, all right? And the problem is most Americans are actually bromine toxic. And so bromine will displace iodine. So it's possible that, as you know, T3 has 3 iodines around it, T4 has 4 iodines around it. So what will happen is possibly that the bromine will substitute for the iodine. So a T3 usually has 3 iodines around it, but now it has 2 iodines on a bromine, and therefore the thyroid hormone actually becomes defective. All right, it doesn't work. So where is this bromine coming from? It's coming from rapid rehydration athletic drinks. It's coming from sodas. I think one of the big soda companies very quietly took bromine out of the sodas. Okay. And so if you look on the side, it's called brominated vegetable oil. They use bromine to leaven commercial bakery products instead of iodine. All right. And they use it in asthma inhaler drugs. They use it in bromocriptine that stops lactation, right, in OBGYN. So basically everyone in America is poisoned with bromine, and everyone has stores of bromine. Even if you had the bromine soda like 20 years ago, you still got the bromine. And so when you take iodine, it'll force the bromine out and you'll get sick from it. So make sure you stop. You start with a little iodine and work your way all the way up to like 50 milligrams. But don't do it too quickly because you're going to have a detox from bromine. And you'll find that most of your patients, of course, will get better. All right, but not all of them, because there are other chemicals like fire retardant, triclosan. They act like as an antagonist to the thyroid receptor. They block the thyroid receptor. So fire retardant in the sofa that I sit in my living room that has a fire retardant in the foam, and the fire retardant doesn't actually work very well. But that fire retardant actually will go into your body and act to block thyroid hormone. Triclosan, which was used in antibacterial soap and is actually baked into plastic now in your refrigerators, and some toilet brush holders have triclosan in them. That's a classic thyroid blocker as well, and it'll block thyroid hormone. All right. Okay. We don't have time to get into the iodine that much today, but you guys can go look that up. Okay, so what do xenoestrogens do to people? You can have water retention, 2 to 3 pounds just before your period is the hallmark sign of xenoestrogen exposure. Estradiol and xenoestrogens work together in synergy to make the patients retain water and get them sick. Sugar cravings that vary with the cycle. Okay, and you'll find that obviously it varies with the cycle. There must be a hormonal component to it. And the sugar cravings are a sure sign of, again, the xenoestrogen exposure. In 35 plus women, year-old women and all, for most women, but not all women, for most cycles, but not all cycles, progesterone levels go to almost 0 or less than 1% of normal. And these xenoestrogens are Frankenstein estrogens that do weird stuff to the body and destroys their sex drive. Okay? So how do you treat all these diseases? You simply stop all xenoestrogens. It takes 2 to 3 months for the xenoestrogens to wash out of the body. Xenoestrogens are stored in the fat, and if the patient loses fat, the xenoestrogens are released. So can you name a clinical example of this effect? Anybody? Anybody in the audience? Okay, I'm going to give you guys a hint. Okay, who are these guys? Yep, you're right. It's the Beatles, right? And it says, Lucy in the Sky with Diamonds. Anybody in the audience? Okay. It's LSD, okay, the drug of abuse. So typically you can take LSD, the drug of abuse. It's fat soluble and active at very small amounts and gets stored in the fat. And so what will happen is 10 years later you have a flu and the LSD is stored in the fat. You have a flu, you can't eat for a couple days because you're sick. The fat gets metabolized and released into the body, and then you have a bad trip. All right. I had a friend who worked for Outward Bound in Colorado, and what was happening is the potheads were getting high while hiking. So they're not smoking, but they're hiking in the mountains with my friend, undergoing therapy, right, for their marijuana smoking. And all of a sudden they're getting high. Why? The THC is fat soluble. It's stored in the fat. When they start to hike, the fat releases the THC and they start to get high. All right. Marathon runner's flu, if you go look that up on the internet, maybe. You have a marathon runner who's not running and then for a couple of years, and all of a sudden he starts to run again, he starts feeling sick, and it's the toxins that are coming out of his fat that's making him sick when he starts to run again. So the main route of entry is through the skin. It's 10 times more potent on the skin. The oral cannot be ignored, all right? And it's non-trivial. I looked through 500 shampoos, and only 3 were okay, all right? So I looked through 1,000 lipsticks, and 0 were okay. So again, if you get our product Progestin, it comes with that purple sheet. It is a recommended product list. That product list is made over 20 years, and it was very difficult to find products that were safe without xenoestrogens. Non-trivial problem. okay? Some patients, especially endometriosis patients, have impaired excretion of all chemicals. So these patients, endometriosis patients, have impaired excretion, have fear, stress, anxiety issues, okay? And they usually have 4 things that mark these patients. They're sensitive to small amounts of drugs. So you go, hey, are you sensitive to small amounts of drugs? They go, yeah, you know, when I take a small amount of any drug, it just knocks me out, okay? They're hypersensitive to smell, loss, or they have a complete loss of smell, less common. So when they go to the supermarket, right, they walk down the aisle and they can't stand the smell there, all right? Number 3, they get seasick in a small boat in the ocean, a roller coaster, or get car sick, okay? And they have a positive Romberg test. A Romberg test is when you stand on your tiptoes, right, close your eyes, right, put your feet together, and they wobble, okay? So patients that have these 4 tests, typically, all or some of them, typically have impaired excretion. Again, what they're telling you when they're sensitive to small amounts of drugs is their ability to excrete those drugs is impaired. They have trouble excreting small amounts of drugs. So when you put xenoestrogens on their skin, well, obviously they're going to have trouble excreting those drugs. And they're more sensitive to xenoestrogens. So these patients especially have to be especially careful for eliminating xenoestrogens, all right? So in conclusion, there are thousands of chemicals and herbs that mimic estrogen, and they're known as xenoestrogens. Xeno just means foreign, okay? These do not appear on the blood hormone test, all right? And some foods and chemicals may actually increase estradiol and testosterone, like chocolate, coffee, and cocoa butter, all right? And if the patient totally avoids these chemicals and herbs, then the disease will usually go away in 2 to 3 months, all right? And xenoestrogens are stored in the fat. If the fat is lost, then xenoestrogens are released and the patient could get sick again, all right? And xenoestrogens tend to be ring-shaped molecules, all right? And some patients have fear, stress, anxiety, or psychological stress that have excretion problems and have to be extra careful. So I'm going to give you my video testimony again of another person who's brave enough to put their face on the web, and I am not, okay? And she's my endometriosis patient who had stage 4 endometriosis. And again, she really likes me, and she is trying to promote my product again, but please ignore that. Please concentrate on eliminating just these xenoestrogens and getting well. So here it is.
Hi, I'm Belissa, and I have a story to tell you about how I had endometriosis, and I completely healed it naturally 10 years ago. 17 years ago, I was diagnosed with endometriosis. I had the worst symptoms imaginable. Pain almost every day. I dreaded that time of the month, and sometimes I'd even get my period 2 or 3 times a month. It felt like I had barbed wire inside of me. I was bloated all the time. I was bleeding heavy. I planned my entire life around my period. I was in and out of the hospital, and all my doctors would offer me is high dosages of synthetic, toxic, harmful hormones. And or invasive surgical procedures, one of which even included microwaving my reproductive organs, and not to mention that they didn't even guarantee that that would give me any relief whatsoever of my symptoms. I felt so hopeless and depressed. I didn't even want to get out of bed. Some days, I felt like I was going to die. Ruin my sex life, my self-esteem. It was horrible. And I tried thousands of dollars worth of natural products that claimed that they would help me with my symptoms. None of them did anything until I came across a product that seemed different. It was a high dosage of natural progesterone oil with no side effects. However, it wasn't just that. It came with information about how the products that I was using on my skin and on my hair, the makeup I was using, were harming me. They were actually creating my symptoms of endometriosis. That if I used this product along with making changes in my diet and my personal care program and the products that I used, that I would have relief from my symptoms. I could even heal myself. I called the number that was listed, I ordered it right away, and I spoke with the person that actually created it, Dr. Eckhart. He listened with the most heartfelt, compassionate heart. He listened to my story, he listened to me cry, and he told me this is different. He said, you can't just use this product the way that it's instructed. You have to make the changes in your diet and your personal care products. And I promise you, within a short period of time, 2 months or less, you will notice results within 2 weeks. I read that pamphlet at least 5 times over and over. I made every single change that he suggested, and I used that product diligently. I noticed a change right away. Within 6 weeks, my period was normal. My symptoms were getting less and less every month. 2 years later, I went back to my doctor. My endometrial lining was normal. 10 years later, I am still symptom-free. This product saved my life.
So thanks to that patient for being brave enough to put her name and face on the web. So again, let's talk about, so let's shift gears. Let's talk about natural progesterone versus a progestin. So this is natural progesterone, a bioidentical hormone. It's the same chemical or hormone actually that your body makes. And here's megas or megastrol, and this is a different chemically modified molecule. And you don't be freaked out about this, but just kind of notice the differences. Basically, natural progesterone is goes high during pregnancy. It's safe for the unborn child. Megastrol is something that's patented that I can charge you more for because it's patented and I'm the only one who can make it. Okay, I have this big marketing program and I charge you more money for it. So this is the hormone of pregnancy. It's safe for the little baby. It's made 20 milligrams per day in the luteal phase of your period. During 1 day of third trimester pregnancy, you're making 400 milligrams per day. So the obvious take-home message from this is that the dose for natural progesterone is a wide therapeutic range. It's relatively safe. Okay. Natural progesterone is used by fertility MDs to prevent miscarriages. It does not create birth defects. It's also used to prevent early delivery. Okay, if you look at my website, there's a number of MDs that did use it to prevent early delivery. All right. Megastrol creates birth defects in contrast. Okay. Megastrol creates malignant mammary tumors in beagle dogs. All right. And natural progesterone may prevent cancer. So natural progesterone may prevent cancer. Prospective study done by Johns Hopkins Medical School and published in the American Journal of Epidemiology in 1981 measured women's estrogen progesterone levels, then divided them into 2 groups, one with normal progesterone levels and one with low progesterone levels. It took 20 years to accumulate the people and then followed them for another 20 years. Johns Hopkins Private Obstetric and Gynecology Clinic reported in the American Journal of Epidemiology that the low progesterone group was compared with the normal progesterone group, and it was found the occurrence of breast cancer is 5.4 times greater in the women with low progesterone group. The incidence of breast cancer in the low progesterone group was more than 80% greater than that of the normal progesterone group. The difference is not explained by when a woman began menstruating, when she reached menopause, her history of oral contraceptive use, her history of benign breast disease, nor age of her first birth of her child. No other factor disallows this ratio of 5.4 times more breast cancer in the low progesterone group. When the study looked at low progesterone group for all types of cancer, they found that women in the low progesterone group also experienced a 10-fold increase in all malignant cancers compared with the normal progesterone group. This would suggest that having a normal level of progesterone protected women from 9/10 of all cancers that might have otherwise occurred. And of course, this study was published and disappeared without a ripple, because there's no money to pursue the obvious implication that progesterone deficiency plays a major role in cancer. So natural progesterone protects against endometrial and breast cancer, normalizes libido, less hirsutism, regrowth of scalp hair, improves lipid profile, improves in vitro fertilization, improves new bone formation, improves sleep patterns, but there's little profit to be made. Progestins, loss of mineral electrolytes from the cells, intracellular edema, depression, birth defect risk, more body hair, thinner scalp hair, thrombophlebitis, i.e. clots in your veins, decreased glucose tolerance, cholestatic jaundice risk, acne and skin rash, large profit while under patent. So, treatment outcomes with natural progesterone. No progesterone, avoid all xenoestrogens, endocrine disruptors, the patient becomes well. Okay? So these are all the treatment outcomes with natural progesterone that you can have. So when you treat a patient, these are the things that can happen. Okay? So one, you give them no progesterone, you just avoid all xenoestrogens, you stop poisoning yourself, you don't even need the progesterone. Let me emphasize this again. The patient becomes well. You stop poisoning themselves. Okay? Number 2, You take progesterone. The progesterone balances out the weak xenoestrogens. Patient feels better, takes progesterone for her entire life. My aunt, she feels better, right, taking progesterone. And she says, can I drink coffee with this? Because the coffee makes me feel lousy, but I take progesterone, I feel good. I go, sure, do whatever you want. It's my aunt. I got to give her free progesterone. So it's like, well, you still want to drink coffee? You want to take progesterone? Okay, you feel better. Okay. People get pregnant all the time. They come off xenoestrogens, right? Take some progesterone, they get pregnant. You can also use it to prevent miscarriage, okay? Number 3, you can take progesterone. There's this paradoxical effect, and we'll talk about this a little later. The progesterone accentuates the strong xenoestrogens. Progesterone wakes up the estrogen receptors. The patient yells at you. So we're going to talk about that later. Number 4, they take progesterone. Progesterone works for 2 to 3 months, then does not work. This is due to the paradoxical effect. Take progesterone, the patient feels nothing. The patient is taking a herb that is progesterone antagonist, like aloe. Aloe is used to create a first trimester miscarriage. Again, I'm not against aloe, okay? I'm from Hawaii, and if I have a sunburn, I'll use aloe. But there's certain cultures, and I don't agree with this morally. I find it morally repulsive and abhorrent that if they don't want their baby in the first trimester, they'll just drink a whole bunch of aloe and it'll cause a miscarriage. All right? I had one patient, and she had trouble getting pregnant. She came off all xenoestrogens, and she actually became pregnant. She didn't know that. She was drinking tequila. She started developing some contractions. And I said, well, actually, she started doing contractions, and she said, could alcohol have caused it? I said, no, alcohol usually calms it down. And she felt guilty because she knows about fetal alcohol syndrome, right? And I said, well, what did you drink? And she just said, I drank tequila. And I said, well, that's interesting. Tequila is made from agave, and agave in Mexico is traditionally used to create miscarriages. So agave is a progesterone blocker. Okay, so I'm not against tequila. I'm not against agave. Okay, but if you're pregnant, I'm not against aloe. Okay, aloe is used for immune dysfunction, right? It's used to get rid of sunburn, right? And some people actually use it against viruses to build up your immune system. Okay, I'm not against all those herbs. Okay. But some of these herbs may have progesterone blocking effects. So if you're pregnant, I would not take them. Okay, so a lot of people have aloe in their skin cream, right? And does it pass the skin barrier, right? I don't know, but I would be careful, all right? Because it may be contributing to your first trimester miscarriage. An obese patient takes progesterone. The patient feels nothing. Because the subcutaneous fat is so thick, so I advise this patient to use it on the inside of the arms and legs where the subcutaneous fat is the thinnest. So what is this paradoxical natural effect of progesterone? Okay, so the patient is taking a strong xenoestrogen, say lavender or rosemary, all right? And the body, to protect itself, down-regulates the estrogen receptor. The body becomes less sensitive to estrogen. So the body protects itself and shuts down its sensitivity to estrogen, okay? And then what happens, you take the progesterone, it wakes up the estrogen receptor. And now the patient becomes more sensitive to existing xenoestrogens. They become worse. So you give them progesterone, they have hair loss, they have fat gain, increased bloating, increased cramping, increased bleeding, more migraines, and more endometriosis pain, and then they start yelling at you. So let me give you an analogous situation. It's like going to a loud rock concert, okay? And initially, the rock concert sounds really loud, but after half an hour, right, it's not so loud anymore. And the reason why is your ears have down-regulated. They become less sensitive to the noise. When you take the progesterone, it wakes up the ears, and the rock concert becomes loud again. So this is this paradoxical effect. So you think, hey, I'm going to give this patient progesterone. It's going to help, right? And she gets worse, and she starts yelling at you, and that's because it woke up the estrogen receptors. So it's not the progesterone. It's waking up the estrogen receptors, so they're more sensitive to the existing xenoestrogens that they're putting on their skin. Okay, so let's talk about some case studies right now. Okay, let's talk about a prototypical patient. A 45-year-old lady comes in complaining of low progesterone and ovulation. Can anybody in the audience tell me what anovulation is? All right. Okay, anovulation is not ovulating. So for most women, after the age of 35, they have just a couple children, right? After the age of 35, for most cycles, but not all cycles, they're anovulating, which means they're having a regular menstrual cycle, but they're not popping out an egg. So what happens before the age of 35 is the ovary comes up, pops out an egg, and the used follicle becomes a corpus luteum, begins to produce progesterone, right? But after the age of 35, for most cycles, but not all cycles. For women with few children, what'll happen is the follicle comes up, goes back down. No egg is popped out. If there's no egg that's popped out, there's no corpus luteum and no progesterone is produced. So a 45-year-old lady, or any lady after the age of 35 years old, for most cycles, but not all cycles, her progesterone level is always 0, right? It's always less than 1% of normal, all right? Now, if the lady had like 9 children, then anytime she's pregnant, she's not ovulating, right? She's not having a cycle, so she's saving up her eggs. So it's not unusual if you had a patient with 9 children and she's like 45 and she's still ovulating, she's producing progesterone, okay? So this 45-year-old lady complaining of low progesterone, that's normal for most Americans who have a few children, all right? So you give them topical progesterone, right? And 1 week later, you do a blood test. And the blood test for progesterone comes out very low and unchanged. Can anybody tell me why? Okay, here's the answer. And usually most physicians get this wrong. Most patients get this wrong. But the topical progesterone does not appear on the blood test, only the saliva test. So please remember this because you're going to get all embarrassed. All right? So basically, topical progesterone does not appear on the blood test, only the saliva test. So the endogenous progesterone, which is the progesterone that's produced by your own corpus luteum, is bound to sex hormone binding globulin. And that protein-bound hormones are not biologically active, but represent 90% that's found in the serum. Okay? Topical progesterone is in the oil fraction of the blood, since oil and water don't mix, such as the chylomicrons, the little oil droplets in the blood, and the red blood cell membranes. All right? The unbound hormones are biologically active. The non-protein bound hormones will filter directly into the saliva, whereas the sex hormone binding globulins, bound progesterone, will not. So saliva hormone assays are less expensive, they're very accurate, and they're more relevant. So again, if you look at this graph here, you can see at the top of the graph, we have at time 0 is when you put the topical progesterone on the patient's skin, okay? And then about 2 to 3 hours later, the saliva levels of progesterone spike outwards, and then 7 hours later, slowly go down. The serum levels, however, go up and down very low. They're just very small. They don't go up at all. So again, topical progesterone barely shows up on a blood serum test, but the saliva testing gives an accurate portrayal of its presence in the body. So please remember this, okay? Topical progesterone only shows up in the saliva, not the blood serum, since oil and water don't mix. Okay, here's a real case study. We're going to talk about another case study. A woman calls out with 10 years of menstrual migraines. Okay? And basically, I asked her, do the migraines vary with the cycle? I said, yeah, every time my period comes, I get a migraine. Okay, so I said, well, obviously, there must be a hormonal component. Do you not agree? And she says, yeah, obviously there's a hormonal component. So I said, just follow the recommended product sheet of products that are free from xenoestrogens, right? You don't even need the progesterone if you don't want it, right? And you can take natural progesterone if you want to, but you kind of don't need it. The result was 6 months after 10 years of menstrual migraines, and now she's got no migraine at all, okay? Then after 6 months, she's got migraines, bloating, breast tenderness, 9 out of 10, lower right abdominal pain. Why? What would you guys say to her? Okay? Now, there are a number of physicians that would do a CAT scan, okay, to look for a ruptured appendix because she had a lower right, 9 out of 10 lower right abdominal pain. I certainly agree with them, right? Because you want to practice defensive medicine. You don't want to get sued, right? It could be a ruptured appendicitis, or it could be, right? So, but I told her, hey, you're doing something different. And she told me, no, I'm not. I didn't change anything. I said, yes, you did. So we have an hour-long argument about that. Okay, she hangs up. And she does a CAT scan, MRI ultrasound, because he's double in pain. He goes, you got to help me. I'm in extreme pain. She goes to OIGN. She does all these MRI ultrasound tests. Can't find anything, right? And then what happens is she calls me up after these tests and says, hey, you got to help me out. You got to help me. I'm in extreme pain. They couldn't find anything. I said, well, obviously, you're doing something wrong. Okay, so another week passes by. On Saturday, she calls me up again, and she goes, I found it. This chapstick contains cannabis oil, right? CBD oil. I said, you're absolutely right. There are 5 different chemicals that mimic estrogen in marijuana smoke condensate. Thin women who smoke marijuana have an increased incidence of ovarian cysts, and the reason why is fat woman, all the fat soaks up all the marijuana smoke, right? And the body doesn't see the CBD oil. But thin woman, the body sees the CBD oil, and you develop an ovarian cyst from the Frankenstein estrogens, okay? So Thursday, she calls me up. The migraines are better. The bloating is better. The breast tenderness is better. The 9 out of 10 abdominal pain, lower right-hand corner, used to be 9 out of 10, and now it's a 3 out of 10, okay? But the patient says she doesn't believe me. She only uses the chapstick with the CBD oil in it 3 times a week. What would you tell the patient? Right, that's what I told her. I said, lady, you don't believe me? Why don't you use the CBD oil again and see if the ovarian cyst comes back, right? And she says, quote, hell no, I'm not going to do that again. Okay, so at one point, the patient doesn't believe me. Okay, but at another point, man, she's not going to do that chapstick again because she feels like it's going to happen to her again if she does the CBD oil again. So what's the take-home lesson? A high estradiol is about 300 picograms per milliliter, or picograms per gram, okay? That's 0.3 parts per billion. That's extremely small, okay? So you spit in 1 ounce of spit into a living-sized swimming pool, that's 1 part per billion, all right? So what we're talking about is extremely infinitesimally small amounts of endocrine disrupting hormones that'll make a major difference in the patient's overall health, which is very surprising. About like 10 years ago, I had 3 different patients from 3 different parts of the country tell me that their mascara made them bloat. And the first lady who told me that called me up on a Monday. I thought she was crazy. And I told her, you're crazy, lady. She goes, no, really, this mascara is making me bloat, okay? Second lady calls me on Friday from a different part of the country. They're unrelated. She said, Doc, I just want to let you know I'm using this mascara and it's making me bloat. I went, really? And 3 months later, a third different lady told me the exact same thing, unrelated to the first 2. Doc, I just want to let you know mascara is making me bloat. And the reason why is these hormones are active at fractional parts per billion, okay? So I'm going to tell you another case study. Here's a premenstrual dysphoric disorder case study, okay? This lady, again, was very brave, and she put her real picture up on the web. Her name is Lori, okay? She has a good marriage, 1 child, goes to church, financially fine, but she's suicidal just before a period. Every period she's suicidal, okay? And she goes, I don't know why I'm suicidal, right? So she was offered a hysterectomy, okay? She bought her progesterone, immediately used it, and immediately she blew up, quote unquote, she said. She developed breast tenderness, bloating, extremely irritable, even using the progesterone. Why? Paradoxical effect, right? Basically, she was taking some strong xenoestrogen, took the progesterone, woke up her estrogen receptors, she got worse, okay? So she calls me up, and she goes, what's going on? I said, well, it's because you're using strong xenoestrogens, the progesterone woke up the estrogen receptors, okay, and now you feel worse. You have increased bloating, increased breast tenderness, you feel lousy. So she removed all xenoestrogens, took no progesterone, and 45 days later, she has her period. No PMDD, no suicidal thoughts, gone in 45 days. She was offered a hysterectomy. She's only like 35. Okay? So after several months, in September 2018, I emailed her, and she said, how are you doing? She goes, oh, I had a setback. I had 4 days of depression. Not as bad, but why? Anybody? Okay, so I said, well, what did you do? She goes, well, are you poisoning yourself again? She goes, well, I'm a student. I'm a teacher's assistant, and I'm using Clorox wipes to wipe down the student's desk. Could that have caused it? I said, certainly. I would use some kind of gloves and then use the Clorox wipes, right? And so I said, I don't know what's in those Clorox wipes. Maybe that could be causing it, right? And then she said also, she started to lose weight and gain muscle. She began to run half marathons, right? So I said, yeah, the fat's stored in the xenoestrogens, right? When you start to run, the xenoestrogens the fat will release the xenoestrogens, and you'll get PMDD again. So you're not having a setback, you're having a detox. Okay, so here's the take-home lesson. Xenoestrogens are stored in the fat and can be released later when the fat is lost. LSD, the drug of abuse, 10 years later, as you recall. So last case study, I had a 30-something woman with menstrual cramps for her entire life, ever since she had menarche. She follows a recommended product list for 2 months, and there's no change in cramping and bloating. She's mad. She goes, I spent all this money on all these xenoestrogen-free products, and I'm still got cramping and bloating. And she says, this is too expensive. I said, well, it doesn't have to be expensive. You can just use a bar of soap and laundry detergent. Okay, it's no problem. So I took an hour to go through all her topical cosmetics. I couldn't find anything. Her nutritional supplements are clean. All right. And then I, talking to her about what she's eating, I said, are you taking stevia? She says, yeah, I'm doing that. I said, no, you can't do that. That's an endocrine disruptor. And then she said, you said I couldn't have coffee. So I'm taking this coffee substitute. I said, no, you can't have that one. It has an estrogenic herb in it. As you can see in the ingredient list, you can't have that. I said, are you eating any other herbs? And she goes, well, I'm eating dill. I put dill in every meal. I love dill. I said, well, I've never seen dill as an endocrine disruptor, but I would be very careful because all herbs tend to be endocrine disruptors. Anything that's fragrant tends to have a benzene ring in it, and it may be an endocrine disruptor. So if I were you, I'd stop dill. Okay, the reason why some plants have thorns, some plants are poisonous, some plants are fragrant to repel animals, and the way they're doing that is they're making it hormone disruptive. Again, if you Google sheep clover disease, you'll find that clover imported to Australia during the 1950s after World War II actually caused miscarriage through formatin, which is a progesterone blocker. All right, but anyway, so she's cut out the stevia, coffee substitute, and dill, and 45 days later, no menstrual cramps for the first time in her life. And you look at stevia, right? There's the ring-shaped compound for Estradiol, and it does all those things. All right. So, in conclusion, all right, most female hormone diseases and prostate issues are easy to treat by avoiding endocrine disruptors. But it's easy to miss a xenoestrogen exposure, okay, and patients don't want to do it. I used to have an avoidance list, okay, now I have a recommended list because it was very difficult to find those recommended products. Okay, about like 10 years ago, my patients were not getting well. I'm going, don't you know that you have to use this that shampoo that you're using, okay, has an endocrine disruptor in it? And they go, well, that's the only one I could find. So I began to look through all the shampoos. I looked through 300 shampoos, 500 shampoos. All I could find was 3. I go, no wonder why patients are not getting well. I can't even find a safe shampoo. Okay, so I have a recommended product list. And again, that's our purple sheet if you order a product, okay? Most xenoestrogens are ring-shaped compounds, all right? Xenoestrogens do not appear on the hormone test. They act directly on the estrogen receptor. One small slip-up of not avoiding xenoestrogens and disaster. Xenoestrogens are active at fractional parts per billion. Xenoestrogens cause magnesium deficiency, muscle cramps, vessel constriction, some Raynaud's and some migraines, calcium deposition, bone spurs, microcalcifications of the breast, tendon calcifications. You usually have a chocolate craving before your period. Okay. Xenoestrogens also cause vitamin B deficiency, neuropathy, burning sensation, loss of sensation, creepy crawling sensation, restless leg syndrome. Xenoestrogens cause thyroid hormone to become less sensitive. Thyroid hormone is normal to low normal. Gain weight despite dieting. After the age of 35 with anovulation, fat on the belly and hips. After age 35, decreased libido. Progestin causes birth defects. Natural progesterone does not cause birth defects. Natural progesterone can act as a band-aid for weak xenoestrogens. Natural progesterone can make the patient worse if they are simultaneously taking a strong xenoestrogen from the paradoxical effect. Some herbs and chemicals can block the action of natural progesterone by being an antagonist. Antagonist means blocker, okay? Transdermal natural progesterone can only be measured with a saliva test. A blood test will not measure transdermal progesterone. So basically it's this, okay? If you just simply stop poisoning yourself, then all diseases will disappear, all right? Because they're all endocrine disrupting diseases. Topical progesterone can act as a band-aid for weak xenoestrogens. You can also take some supplements with it, okay? And here's my set of references. Again, there's John Lee's books, all right? And I suggest that you read all of them, all right? Our Stolen Future by Theo Colburn is very interesting. She talks about endocrine disruption. It was on the New York Times bestsellers list. And it talks about endocrine disruption in these animals. You have 2 infertile female gulls standing over infertile eggs over this nest, and she goes that something's not quite right. And so she goes and explains why that's happening. You can go to bcpp.org on the Breast Cancer Prevention Partners, and I'm just telling you what they're saying. Okay, I'm making it more practical, and what they're saying is all these topicals may have chemicals or herbs in them that are estrogenic that may be causing breast cancer. You can go to Tulane University under hormone disruption and go to ehormone.tulane.edu, okay? And there's a more academic response to hormone disruption, okay? And there's also a section for the layperson. You can read about it. And you can also go to my website at www.clearwoman.com. Okay, so here's my last video of the day. Okay, and here we go.
We're exposed to chemicals through air we breathe, in our food that we're eating, in various products that we have in our house, whether it's products that are stationary like our couch, but also products we use that we put on our bodies like lotion and shampoo, or the building materials we have, and in the water we drink. People didn't really appreciate that there was all these chemicals in these things that they were putting on their body that they just assumed were, quote, safe. People are exposed to many different types of environmental chemicals or industrial chemicals, particularly during pregnancy and developmental periods. We're very interested in what happens immediately after pregnancy, so looking at, are babies born too low in their birth weight, so low birth weight? Are they born too early, so preterm birth? One of our things is to take the data that's out there and process it and make it understandable to people. One of the things we're known for is talking about the growth in chemical manufacturing in the United States, which we have a very famous graph that shows how it's gone up over 15-fold since the 1950s. But the thing that's changed is that doctors are now seeing this themselves, meaning that their patient population is changing in ways that can't be explained by genetics. We worked with a doctor who was an obstetrician, and she told me that at the beginning of her practice, she'd have many regular, routine, normal visits with a few anomalies, a few challenging cases. And slowly over time, it shifted to where most of her cases were challenging and she didn't have any more normal visits. More kids have autism, more kids have ADHD, more kids have childhood cancer. And because they have seen the shift in their practice, they appreciate that there's something environmental that's going on. So we've done a lot of work here at UCSF to engage with the physician community, which has been very successful now. The national physician community of obstetricians and gynecologists recognize the importance of environmental chemical exposures. And they say that chemical exposures can both affect reproduction and development, and that doctors should be actively engaged in reducing their patients' exposure. A lot of our health care in the United States is driven by when you're sick. And of course, when you're sick, you got to take care of it. We want the best treatment possible for people who are sick. And it doesn't value the prevention side as much. So we really want less people going into the sick pipeline, but the money, financial incentives are not quite aligned correctly for that. So there's a lot of things that you can do to reduce your own personal exposures. There's some very simple things you can do that don't cost any money. So things like washing your hands before you eat, because a lot of chemicals get into dust and they hang around there. Eating organic is a really good way to reduce your exposure to chemicals. There's cleaning solutions you can make in your home that are very simple that you can use. Vinegar and water and baking soda are good ways to clean that can also minimize your exposure to chemicals. Don't microwave in plastic, don't buy scented products. It can feel a little bit overwhelming at times, but I also think that we've seen great changes happen because of the engagement of citizens. To deal with chemicals and the environment or industrial chemicals, you really have to focus at a system-wide level. You have to focus at kind of at the top, because so many of the pollutants are being put out at places that only the government can intervene to stop them. And speaking up in public ways or to public officials makes a difference. Just even voting or connecting to organizations that represent your interests. So there's a whole range of ways that you can engage that still will make your voice heard to the people who are making decisions about that's going to affect your health.
Okay, so here are the notes associated with the lecture, and thank you for your time, and I hope that you get better. Come visit us at www.clearwoman.com. Again, thank you for listening to us. All right, thank you. Bye.